will be happy. I'm going to history of food. So we take food because the food is of two types, plant food and animal food. But why we take food? Because we want to energize our body. So I'm revealing like 5 secrets. The first secret is very easy. One body will energize another body. So if you take a plant food, that is also body, right? That will energize our body. If you take animal food, that is also will energize our body. So fundamental truth is, again our acharyas, they represented this little finger as body. After eating food, we energize the body, we want to be healthy, but we find that we fall sick. Then somebody says, no, you have to take not only the food that you are eating, you have to take some another different body, another different plant. So that is how herbs came into. So herbs you take, then it will be energizing your body, that your body was not energized by the food. So then came herbs. People thought, okay, we have to take a lot. How to take 1 kilogram of mint for a cold? We cannot take. So the only solution is concentrated. Grind it, make a syrupy solution and concentrate it, then drink, but then 1 liter you cannot drink. So then came pills. They concentrated it. Now also, if somebody says, okay, for eyes you have to eat carrots. But then we say, oh, I cannot eat 10 kilograms of carrot, I'll better take a vitamin A pill. Vitamin A has the concentrate of that. So that is why I have given a formula. This is from the net also. How 365 leaves you can take as a syrup in 75 drops, but instead you can drink in 1 small pill. So I'm just showing how the history of medicine developed, especially in the western side. Then what happened was the pharmaceutical companies, when they want to market, they want to get a license for a pill, that this is, let's say, for a headache. So if they want to market a pill for headache, they have to show the government that just because of taking this pill only the headache was cured. So how do they do it? This is how they did. They have a treatment group and a control group. So this 100 people having headache, here also 100 people having headache, but here they give no pills, they give pills there, and then what happens? Those people get well. The headache is gone, here they don't get, so they tell the government, this is the data, now this we prove that because of our pill only, headache gone. The one incident happened in Second World War that completely turned off the way they were doing research. What happened was, I will tell the story very quickly, that there was a medical camp in, I think it was in Italy or France. The medical camp, what they were doing is, all the wounded soldiers will come, the nurse and the doctor, they will be actually giving painkiller injection, because the patients are, the doctor will actually, every day the doctor will bring the pain injections and the nurse will give to these wounded soldiers. That evening the doctor didn't come. The reason was, and so he couldn't cross the bridge, so he couldn't come. And not like now modern times, they had a cell phone to tell the nurse that I'm not able to come, you have to somebody manage. So this nurse is keeping on wondering why the doctor didn't turn up. More than that, all the soldiers started to be agitated. They said, we are in pain, please give the pain injection, we have to sleep, it is now 9 o'clock. The nurse said, just wait another 10 minutes, the doctor will come. But again, half an hour happened, then it was 10 o'clock, the patients got, the soldiers got really fury. Nurse knew that in another 10 minutes, they will all pound her, make like a chutney. So she got scared, so she thought, let me just, the doctor will come in another half an hour or so. So just to keep them quiet, she thought they won't know if the injection, the pain medication is just like water. So what will happen if I just inject them? Water. So plain water she injected to them. And then she thought by the time she covers everybody injection, the doctor will come, then she will give the real medication. But so she gave the medication and then she sat in the chair and then she dozed off. And morning, when she woke up, it was morning, and she thought, what happened? The doctor didn't come, and she thought, there is no noise, what happened to the soldiers? She went to the room, they were all snoring and sleeping. She couldn't believe. What? How come these people are sleeping? So then the doctor came, then she said, the doctor also could not believe. Really? With water, they all had good sleep. This is unbelievable. Because that term came, remembered wellness. So there is something more powerful than the medicine. So the soldiers believed that they were being given pain medication and they were able to bring an effect. So after that 1944, this incident happened. The doctor gave, he did many research. I'm not going into all that part. So he then the government made a rule. Hereafter we have to make another group we call placebo. I'm going to use this word placebo. Placebo means somebody, they wanted to test really the herb or the medicine has an effect, or it is just because they have a thought that they have the medicine. So that group is called placebo. So what will happen is, let's say now again they want to market a headache medicine. They want to know, really it is because of the medicine they got a headache cured, or because of thought that they are having the medicine. So 100 people there, 100 people here, they will give the real medicine. Here the people won't be told, but instead of real medicine they will fill sugar and then give. And then what happens is, it was very surprising. Second revealing fact is that more than the body, it is a mind that controls it. The mind has more power than anything, any medicine. But I will make it really quick unless in the end of the talk if somebody wants to more. From 1950s onwards, headache came to not to people, more headache for pharmaceutical companies. They see that more psychiatric, neurobiological indication, pain, hypertension, angina pectoris, IBS, all this disease, many medications are having placebo effect. Meaning what? Really the medicine is not, but just by having a treatment, people are getting well. I have taken, if somebody wants a PowerPoint, I'll be happy to share. All these are not stories made by me, but it is all from very peer-reviewed journals, medical journals. I have given the reference here, you can always go and check. Then, more than just the feeling of the mind, having the treatment, are there more thoughts that can influence the medicines? So, what they found was price as an effect. Meaning what? If two groups are given the same medicine, but one group was asked to buy the pain medication for $1, but another group $25. So if the medicine has real effect, both should be equal, both the groups should be equally getting the same response, right? They found that for the same medication got better more. Is it only price? They found that even the geographical distribution. So let's say pain medication, one group, they gave the medicine that this is manufactured in China, and another one says it is from US. Which one do you think will have more effect? US. And they proved it. Again, see, MIT means it's a gold standard for all of us. We'll all be thinking, even this is also an effect, right? If I say somebody did, you won't believe. So I was in India. I hate to be told that about my qualifications and all, but I told my uncle, this time you have to tell a lot about me, that I went to Singapore, I went to Malaysia, I was in Germany, all tell the truth, but you have to tell me more about me, because then they will have more effect. Even color of the pills, look at this. Yellow color, green color, red color, even those made a difference. Larger the pill, the same medication they made, big size pill and a small, like a homeopathic mustard size, the same dose, but the mustard size group, they didn't have much effect, they had less effect. The big pill, big effect. More than one pill, two pill, if the doctor gives the same medication they gave, the same headache medicine, they split into two. But the patient didn't know. The patient thought, okay, two medicines. Then the headache went to effect was much better. So two pills better than one. Brand name pills, you know, capsules are more effective than the pills. And then injections have more effect than that. So they wanted to know, it's only for adults or even children will have an effect. So this was done by pediatrics, this was published in Pediatrics Journal. In coughing children, they divided into two groups. One group, they gave the real cough medicine. Another group, they gave flavored water. Cherry flavored, agave flavored. And understand the results? They found that children who took the flavored water, they became well. Cough gone. So not only for adults, children also. They made the same doctor talk in two different tones to two group of patients. One group, the doctor said, this is very good. This treatment that I'm going to give will make you really better and all that. And then the same doctor to another group said, well, I think so, you will become all right. Imagine who got better? This group. So the doctor's just verbal clue itself makes. So the person who is giving the medicine, also has an effect. Medicine, they made a study. Now let's see, is only on medicines it has an effect. What about surgery? So in the New England Journal of Medicine, what they did was they had this knee replacement. You know, where old people, they have arthritic pain and the joints are all inflamed, so they have to change the knee. So they took, they divided the group into two. No clue to the patient that they are having a real surgery or a placebo surgery. So what they did was, they took 140 patients, and the 140 patients, they wrote in each one name in an envelope, and then in the patient name will be written, and then below the real surgery. Another patient name will be written and say placebo surgery. And then they will all put in envelopes, and when the patient is brought to the surgery room, the envelope also will be brought, it is stuck, so nobody would have read, and then the patient is given anesthesia, gone, right, unconscious state. But the doctors know that there are many reports that even unconscious, they may be listening to what the doctors are saying. So the chief doctor will open the envelope. Okay, he reads as this patient, real surgery, but he won't open the mouth. He will just pass on to the assistant surgeons, and they'll all read, and they'll just nod their head, okay, real surgery. Then they give it to the nurse and all the assistant. Nobody will open the mouth, they do the real surgery. Then the next patient comes. The chief doctor's open, it says placebo. But he won't open the mouth. He will give to the next assistant surgeons. Everybody reads, nobody opens their mouth, and then they switch on the video camera. That will have the present, how the original surgery was done. So they want to make sure no steps are missed. Exactly how they see, they mute, of course, they mute the video, so that nobody will know. So they are all looking and they're doing, and after that, the doctor said, no, we have to make the patient who is unconscious feel really the surgery has happened, because what they're doing is they will cut the knee, they will open it, but instead of knee replacement, they just close it back. That is what they're doing in the placebo surgery. But then the unconscious person will be thinking, why I'm not hearing any sound? So what the doctor said is, okay, when I cut, I have to give the scissor. Immediately the nurse will show the tray, right? And then doctor will put, cling, sound comes. So the doctor said, we have to do that. So cling, they did the sound. So the unconscious patient is thinking, okay, real surgery is going on. No, I'm not joking. Really, they did all that. That's why it's a very fantastic study. Now look at the results. So 140 patients, 70 of them got